everybody, and welcome to Tuesday Training. I hope you're having a fantastic week. As always,
we are live from Austin, Texas, right here in Insurance Syndicate headquarters. And man, we have a great show for you.
Good morning, everybody, man. Thank you for tuning in. We're having some minor technical issues today, hence a few minutes late. And you also see at the top, this is being streamed from Joe Campert. So I am currently, just to let you know, I am currently banned from going live on Facebook for 30 days because apparently I made a post that they didn't like at all. So go figure. Pretty simple. We'll have it cleaned up, but for the time being, we're looping around. You'll see me going live as Joe for a few days here on the Syndicate Show. So thanks for tuning in. It is going to be a fantastic show for you guys today. I guarantee you. We don't have a lot of news, so we are just going to dive into it. But a couple of quick announcements. You might see some new framing around the show. This show is now sponsored and brought to you by Done For You CRM, DFY CRM. And I have been using DFY myself as a user in the Medicare space for 2.5 years now. Absolutely love it. As you know, it is a white labeled version of the Go High Level platforms that are out there for agents that you can use as a CRM tool. The functions that are inside of it are absolutely insane. The reason I chose DFY is a couple of reasons. The biggest one is being that he already has custom workflows that are proven that work in the health industry. Whether you're in the ACA space, you're in the Medicare supplement space, the dental space, the Medicare Advantage space, whether you're doing it in English or you're doing it in Spanish, doesn't matter. He's got pre-built workflows for you that will help you nurture and cultivate business absolutely at an exceptional clip, whether you want to do it through text message, email marketing, etc. It is all built in there. Some of it is custom work that I've added to it and allowed him to share with people as well. So great tool. If you are interested in checking out the DFY platform, give my buddy Eric Fierro a holler. You can look him up on Facebook. And certainly feel free to reach out to me and I can point you and get that connection. He'll get a demo made for you. But absolutely outstanding platform and super happy to have him on board as a sponsor here for Tuesday Training. One more quick announcement. This week is a busy week here at Syndicate headquarters here in Austin, Texas. Coming up on the 20th, on Friday, we have a content creation workshop going on. This is a full day of content creation that we are going to be coaching and training agents on. The first half of the day is the basics, right? How to get yourself set up, how to do your scripting, how to build your content, how to repurpose and amplify your content, right? So there's going to be little workstations, if you will, that the attendees will rotate through. Well, they'll learn the different topics and learn how to put them into play and start building their content. Then we're going to break for lunch. And then the VIP ticket holders, they're going to go out, or I should say as a group, we're going to go out and shoot content live in Austin, Texas. So we have several locations that we put together. The VIP ticket holders are going to get a lapel mic, a ring light, a selfie stick, everything that they need to immediately go out in the live real world and start shooting content. And our goal is to help you assemble 6 months of content so that for the rest of the year, you're going to have exceptional content that you can use and repurpose to help grow your business. That is the content creation workshop right here at Syndicate headquarters this Friday. Also, we're doing some pre-gaming on Thursday here from noon to 6. We're going to do a public speaking workshop. It's a small add-on that you can add to your content creation workshop where I'm basically going to help you get these courage and the skills to start speaking in public, whether it be on camera or whether it be on stage or in a group. We're going to get you the encouragement, the skills, the scripting, the concepts that you need to help get out there and start putting your message to the masses. So sign up for that. Hit up Joe Campert or L. Denning or David Denning. They are co-opting that with us. Hit them up, man. They'll get you the details. They'll get you a ticket and then get your butt here at Syndicate headquarters. Definitely for Friday. And if you want some extra public speaking chops, show up for Thursday too. I was on 26 stages in the last 12 months last year. I've definitely got the skill set to get on stage and talk to people, and I definitely have the ability to coach you. This was a curriculum that I actually partnered at one point with Cody Askins on for his public speaking workshop. You can ask around. It went out like gangbusters. But since then, we've all done kind of our separate things, and I'm bringing that workshop in-house now since it is my own proprietary content. So super looking forward to that one. But without further ado, I want to get our guest on stage. We have a couple of guests from Virtuous Benefits. We got Angel Salcedo and Neer Patel. These guys are absolutely out there disrupting the group benefits market through direct primary care. And that's what we're going to talk about today. So first and foremost, man, thank you guys for coming on and joining us for the show. I really appreciate it. It is great to have you. Neer, I'm going to start with you with just real simple help these people out here understand what is direct primary care for those that might be unfamiliar with that concept.
Absolutely, Tony. Thanks for having me today. So direct primary care is an affordable model of doing primary care in a subscription way. So rather than sort of what we feel like is a broken healthcare system where primary care doctors are incentivized to, see you over and over again and keep billing your insurance over and over again in the insurance model and essentially keep you at a constant level of sick. Direct primary care doctors have the opposite incentive. They charge an affordable membership fee, like a gym membership, around $100 for adults, half that for kids. And now their incentive is keep you as healthy as possible for as long as possible throughout your life.
When you say their incentive is to keep you as healthy as possible, like what incentives do they have to be incentivized to keep you healthy?
Well, they operate under a membership model. So the less they need to see you, that's their incentive, right? And so if they keep you healthy over the long term, they don't need to see you as often in the office, which means that's essentially their incentive of keeping you healthy and having a good work-life balance.
Makes sense. So real quick, Angel, take a quick moment and just let us know a little bit more about who you guys are and why y'all are at the forefront of this, and certainly the experts that can talk about how this is disrupting the group space.
Of course. And just want to say thank you for having us. Love the energy of the podcast. So what makes Virtuous Benefits different is our approach to healthcare and health insurance. Most health insurance, and of course, when we say most or traditional, as most people know it, is network-based health insurance, where we all know the big carriers in the market, your Blue Crosses, United of the world. They all say that they're the best. They have the biggest networks, right? But the cost of that insurance keeps going up and up. And not only do you not have real answers, there's no solutions out there that are feasible. Virtuous Benefits really starts disrupting that by removing the network entirely, giving you access to a DPC, and providing top-of-the-line care navigation. And that's important when you don't have a network, because if anybody has used their insurance before, the first thing that they ask when you're at a new provider is, who's your carrier? Are we in network or out of network? So you're going to need some assistance. So Virtuous Benefits provides all of that so that when you're using an insurance plan that is non-network based, all of a sudden you now can go anywhere you want in the country with no restrictions. And you have a doctor, as Neer said, that is now incentivized to keep you healthy versus the traditional model. They're incentivized to keep you coming back, which means you're still sick or just maintaining something.
Yeah. Help me understand that a little bit better. I'm in a membership through a DPC group, right? Direct primary care facility or whatnot. How am I eliminated on a network if I'm tied into that membership? That just sounds like another network to me.
So I like to consider it like a team doctor, right? If you think of your favorite sports team, whether it be college or professional, every team of those has a team doctor. And so if an athlete gets injured or sick, no one's asking that athlete, hey, what's your insurance? What's your deductible? There's a doctor on the team that they immediately go to. That doctor already knows them, right? Because when they join the team, they have interactions with them. And that's a much smoother way to get immediate care versus having an insurance plan, right? But obviously, if that athlete needs to go outside of that doctor, maybe a specialist, a surgery or procedure, they have that option, right? So that's the mentality that we have at Virtuous Benefits. We're going to give you a doctor, a team doctor, so to speak. They're going to know you. You're going to have full access to them via phone, text, email, whatever is easier for you. But if you need to go outside of that primary care, Now you're going to be able to go to any specialist, any provider in the country, any hospital, any urgent care center, whatever your care needs, we're going to be able to help assist you that, again, through our care navigation.
Okay. So help me kind of put this into a real world situation. I'm going to see my direct primary care doctor. They're taking great care of me, right? I definitely am getting the sense that it's not a volume play. I'm getting to spend more time with my doctor. I'm building a better relationship. And they say, hey, look, for this, you need to go see a specialist. Now, are they then referring me to a specific specialist that they like? And then what does that experience for me look like when I go to visit that specialist in a real world setting?
Great question. So there's a few avenues you can take. One is your DPC, for the most part, is going to have a recommendation, right? Our mindset is doctors know doctors, right? So they're going to say, you know what, there's this one specialist I know, maybe there's already a relationship there. My suggestion is that you go there, right? You as a patient have a choice. Do you want to take that suggestion, or do you have a specialist in mind that you would like to go to, previous experience, family experience, whatever that may be? Or you may be like, well, I don't really know where to go. Can I use your care navigation to help me find the highest rated specialist in my city or around me to help me get the best care possible? So the patient gets to decide which route they want to take.
And then is that patient then just working that out on a cash payment with that
Exactly.
specialist?
So the beauty of not having a network is that every provider in the country takes cash. They take money, right? At the end of the day, that's how, they make a revenue. And so when you remove a network, there's no longer a pre-existing contract that they have to try to negotiate with, or even as a provider, even if they have a contract, they have to wait for the carrier to pay them. And sometimes that's 30, 60, 90 days out. Mm-hmm. But when you remove that nonsense entirely, when you go get that specialist care, we pay that provider at the time of service, which is really revolutionary and almost an idea that people should have had before, right? That's just like going to buy bread at the grocery store. So when you pay that provider at the time of service, now they're no longer having to delay payment. They typically are able to give you a discount because, again, their cash flow is affected by waiting on an insurance. But when you pay them at the time of service, that's eliminated. And then depending on the plan design that we put together at the beginning, there may be a copay, there may be an out-of-pocket, but the provider gets paid right away. They're not waiting on you for any payment.
Okay. So I remember not too long ago, well, it was several years ago, I take that back. I was working as a W-2 employee with Precision Senior Marketing. I had my employer group plan. I'm fairly healthy, so I'm like, all right, I don't need the most robust plan. So I picked something like a Cigna EPO plan or something that had, I think I had a $5,000 deductible. And that was for everything. That's doctor visits, hospital, whatever. And then when I did go to the doctor, knowing that I'm not going to spend $5,000 with him, instead of using my insurance, because I knew if I used my insurance, he's going to bill a much higher rate and I'm still going to have to pay the full rate because I'm in deductible phase, right? I'm not getting a deal. I just told him, like, hey, don't bill my insurance. I'll just pay you cash money. Mm-hmm. And how much, what can I do then? And I was able to get a little better rate, right? And so that was something I was doing to navigate it. But this is a totally different space. Like, I'm making that decision on my own. But you guys are taking this product and you're pairing it with group plans in some fashion. Can you speak to that a little bit, Neer, and kind of how you're approaching an employee group and being like, hey, look, here's what your experience is currently on your Blue Cross or whatever plan it is that you have, and here's what we can do to improve your benefits or your experience.
Absolutely. Yeah. So to simplify what we do, I like to kind of help people understand that we're now moving you from, Blue Cross or United to a concierge insurance plan, right? So when we do the employee presentation, we bring in essentially our concierge style doctors, our direct primary care doctors, to speak from the heart to the group of employees about why they left their high paying job in the system to open their own direct primary care practice, and start over from scratch again with 0 patients. They're speaking from the heart about why they do that, why they do direct primary care, and how they genuinely want to care for patients in a way that's different than the handcuffs that traditional insurance companies put on them. And then we also explain to the employees, Virtuous Benefits is your concierge insurance agency. So when your DPC doctor tells you to go outside their office for literally anything, a medication, an image, a specialist, just call, text, or email us at Virtuous Benefits, and our care navigation team will contact the facility you need to go to, get their cash price, give you a cash card, right? A virtual payment card that has the amount of money on it that you need for that visit. They'll give you that. It'll be in your portal. You'll get it by text and email, and you just go into your appointment. You pay as a cash patient or a self-pay patient. You use our credit card, and it all runs through the insurance on the back end. I'll give you a quick example of one of our clients in Alabama. They were with Blue Cross Blue Shield. Matter of fact, they're the big Blue Cross ivory towers are directly next door to their building. So they can see exactly where their money's been going. And so they've been with Blue Cross for many years. They have about 200 employees, so they're spending about $1 million a year with Blue Cross and getting 18% increases on that $1 million with nothing to show for it. And so they called us and asked us, what can you guys do to help us reduce our costs and get better care for our employees? We came in, we implemented a DPC pilot program. So the first 30 employees that wanted to try DPC while they still had Blue Cross were able to do that. The company paid for it. We got the employees used to the direct primary care model, right? Working with a doctor that actually cares about them, where they have their cell phone number. They can text them on the weekends when they have an urgent issue at night. They saw the prices that doctor gave them for labs, 10 to 20 times less than what they were paying through Blue Cross. And then we were building their new health plan, which is a Virtuous Benefits health plan that has no network restrictions in the background. Mm-hmm. We launched that plan at their renewal, and we saved them about 10% on day one. We were able to get some feedback, right? When we did the employee presentation, we asked some employees if they would feel comfortable speaking about their experience in the DPC pilot program. Got stellar feedback for the doctors. The doctors were presenting to them as well. Now, we saved them about 10%. So, call it $900,000 to spend in year one of our plan. But $400,000 of that was money that was still their money. So meaning they were able to keep that money if there was a surplus that remained in that account. So if that money didn't get used for claims, doctor's visits, specialist visits, medications, right? All the routine day-to-day things. If there's any money left over in that $400,000 account, that money goes back to the employer. They can give raises with it. They can put it in people's HSAs. They can pay more for insurance for employees and family members, right? Whereas Blue Cross, no matter whether they had a good year or a bad year, Blue Cross would keep the entire $1 million every year and then give them a big increase. So now we have a health plan where they're getting about half their money back, or they have the potential to. So how do they get that money back? By using the direct primary care, right? So they're using these doctors that genuinely care for them under a membership. None of that care is touching that money, that $400,000 to be used for claims. And so the likelihood that there's going to be, let's just call it even 100,000 of that left, is super high. And we're on track for that this year. Their renewal's coming up in February, and we're on track for them to have a nice surplus at the end of this year.
Outstanding. So for the employer, we're seeing reduced costs for the employer based on it's just less money going to a large group company, right? Mm-hmm. But they still have to have those group benefits in some form, right? Because direct primary care is going to take care of the doctor portion, but what about hospitalization, surgeries, things of that nature?
So the other half of that $900,000, that's what covers that, what we call a stop loss insurance policy.
Okay.
So we buy stop loss insurance. That's the real insurance. It's hanging around in the background in our health plans. And they're the ones that are going to pick up the large claims that hit over a certain threshold. And there's no limit to what the stop loss will pick up. So if a large claim comes in, hospitalization, cancer, expensive medication, right? Stop loss is going to pick that up. There's no limit to that. And then it also, if that $400,000 account of small claim money, if that runs out, if that ran out in the first month of our health plan, the stop loss insurance would kick in and pay for every single claim that comes through for the entire rest of the year.
So if I'm an employee and I'm working for ABC, big company that's out there, and they got 200 employees, kind of like the situation you're describing, and they've got me on, say, a Blue Cross plan, You guys come in and you show the employer, hey, this is what we can do for you. That's going to save you money. It's going to improve the quality of care for your employees. What other than improved care for the employees, am I seeing improved costs for the employees as well?
Most employers split part of the premium with their employees. So when we reduce cost, we're reducing the payroll deductions for that employee, right? Also, we are able to include DPC for family members, right, in their premium. So what that means is now your family has access to these team doctors that you can call, text, or email, which also reduces emergency room and urgent care visits. Because if you think about a family, if your child is crying or hurt, the immediate reaction is, well, we got to go to the urgent care or the emergency room. I don't know how to deal with this situation. But if you had a team doctor that you could call, email, text at that instant and tell them, here's what's going on. Is it bad enough that we need to go to the emergency room? Or is it something we can do here or go to your office? Now you have a lifeline that will help you not only get the care you need, but remove that emergency room copay or deductible that you now had to hit. So all of that reduces the cost, but also gives you better care.
Yeah. So let's look at it from the doctor standpoint then, right? We're obviously there's an incentive for the employers. They're going to be able to reduce their cost overall, which helps them increase profitability, which they can use to pass back to their employees in different forms of incentives. Maybe it's increased pay or whatever it is. They're able to provide better level of care to their employees. So, hey, lower cost on your benefits, better benefits. Employees get a great experience as well, right? Because they're seeing reduced costs. They're seeing a higher level of care. What about on the doctor side? What is their incentive to participate in a DPC format?
Yeah, so for doctors, they are getting squeezed tremendously in the insurance world, especially primary care doctors. My wife happens to be a family physician. She worked in the insurance-based system for a couple years after finishing education and training, and she saw it firsthand, right? They're forcing her to see 40, 50 patients a day by herself, and they're bonusing her on how many patients they can get in and out. She can get in and out the door rather than how healthy that she's making people. She has to have one hand on the door trying to get out of the room when somebody's crying, telling her about some traumatic event that happened, because she only has 5 minutes to spend with each patient if she's being forced to see 40 patients a day. And then on top of that, she's got to chart and make sure that there's all the proper codes in the chart for the insurance company to pay her for those visits. So that means after a full day of exhausting day of 40 people, she has to come home and bring her computer and bang on it the whole night to try to remember all the codes that need to go in for every visit that she didn't have time to do during the day while she was trying to shuffle all those people in and out of the office. That is not the way that physicians want to practice medicine.
I wouldn't think so.
They're not happy around the country. And so direct primary care has been an amazing solution for physicians all over the country. Not only for primary care, there's also direct specialty care movement that's also growing now too, where specialists are starting to learn from the primary care doctors how to do this.
Looking at it just one more time back from the patient's experience, what can the direct primary care doctor truly take care of?
So family physicians and primary care physicians, when they go to medical school and residency training, they're trained to handle about 90% of everything that we need for our health. I'm going to repeat that because people are probably shocked. 90% of everything that we need for our health can come from primary care. Nobody probably feels that way when they're working with their doctor in the insurance model. Mm-hmm. For all the reasons I just explained about what my wife was forced to do, right? If a doctor is being forced to see 30, 40, 50 patients a day, that means they can only spend 5 minutes with you. It does not matter what Ivy League training or how brilliant of a physician you are. If you only have 5 minutes with someone, there's really nothing you can do to genuinely help them get healthier other than give them a medication they might not need or send them to a specialist for something you were trained and know how to do. There is that 10 to 15% of things that are outside the scope of primary care. But when you give a primary care doctor time to spend with their patients and good access to the patient, they can do a lot more than we actually think.
Yeah, that makes sense completely. So again, everything looks phenomenal when you think about it from the employer aspect, right? They're saving money, they're improving the quality of care for their employees, so they're providing better benefits. It's a better incentive package. The doctors get a better level of practice for what they're doing. So those are all positives. What are maybe some of the challenges that an employer looks at when they're thinking of bringing DPC on as part of their benefit package?
One of the biggest challenges is convincing their current advisor that this is the way to go. That's part of our conversation with employers, is understanding how your advisor or broker is paid, because that is going to clearly indicate what they're going to recommend. Most brokers, advisors, they get paid a commission based on the premium, right? So if that premium goes up, they just walk out of the room with a raise, right?
Yep.
Not to mention the behind the scenes incentives that these carriers give, bring more business to us, we'll give you bigger bonuses, trips, things like that. And so those incentives are there for the broker to just say, hey, you need to stick with Blue Cross, you need to stick with United Healthcare, because that's the way to go. But if now they're reducing the cost of your insurance, now it means they're going to get a pay cut. Mm-hmm. So most advisors or brokers are not talking about this because it's counterintuitive to their revenue, right? Not to mention the added care navigation that most of them are just not set up to do, right? The moment you have a question regarding your policy, they're like, hey, we need to call Blue Cross or United. They internally are not going to be able to do anything. And right. So that's one of the main hurdles that employers have right now, is that their current advisor or broker is simply not talking about it, recommending it, or worse, they're saying, you know what, this is a little fad that's going on. It's not ready. There's a lot of things that can go wrong. But at the end of the day, they're just making excuses instead of bringing you a solution to lower the cost of your insurance instead of what they're getting now, which is a raise every year.
Is it just a little trend, a little fad that's fancy for right now, and it's probably going to just flash in the pan, go away?
Absolutely not. Not only has DPC been around for 15 years, but this movement that we call our reference-based pricing has also been around for 10 years, and it's getting better every year. With the capability we have now to pay providers at the time of service, we've truly eliminated almost all the noise that comes when you walk in with an insurance card that nobody knows, or really at the front desk, nobody is trained to take, right? Because if you go into, a facility right now, that person at the front desk is typically only trained on a network plan. So you kind of throw them a curveball, all of a sudden they say, we have never heard of this. I don't think this is real insurance. But what our care navigation team does is they will call the billing office, the people that actually take the money for the service, handle everything with them so that the patient walks in, gets the care they need, walks out. Nobody's holding them back or saying we've never heard of this. And so part of that is necessary to make sure all of this works. But that's been going on. We've been around for 5 years at Virtuous Benefits. My background is in the insurance industry. I've been doing this for over 15 years. So there is no way that this is going to just phase out, because it's working and the results are there.
So what made you guys make a shift? Like, particularly you, Angel, because you've been in the healthcare industry before. Like, where along your career path did you say, hey, this old model, this way of doing things, I don't feel like it's sustainable, right? And there's a new shift happening and I want to get on board with that. What did you see that made you believe, like, I need to make some changes and start pushing a disruptive type of healthcare?
So for the first half of my career, I was doing the same thing that every other advisor is doing, right? Making your sales quota, working at an agency, trying to grow your book of business, making excuses of why health insurance is so expensive, taking the client out to dinner or golf, right? Just to make them feel good about the spend that they're doing, but not solving the problem. And after 7 years of doing the same old, and employers complaining to you and employees saying, hey, what are we doing here? I internally started thinking, well, why is this so expensive? Even though I sold health insurance, I had no idea how it actually worked behind the scenes. So I started doing my own due diligence, finding out how health insurance worked behind the scenes, and quickly realized doctors really don't like insurance because of all the things that we've mentioned, but they also need patients. And so it's kind of this relationship that one just needs the other, but they don't really like each other. It's kind of like a bad marriage.
Yeah.
But then I started thinking, well, what other solutions or avenues are out there? And I started exploring self-funding, level funding, which really refers to the structure of your insurance, right? You get to see transparency, where the money is going, things like that. But even then, once I got versed in that, I still realized, well, now I'm just waiting around for something bad to happen. Because even though I know where the money's going, now I'm just sitting there waiting for the ticking time bomb. Once I discovered DPC, I was at a conference about 7 years ago. I discovered DPC. The light hit for me. This is the missing link, because now you're not just sitting around waiting for something to happen. You're actually engaging employees in primary care. Employees are also seeing value in primary care. And that's something I saw within my history. Most employees, they never go see the doctor, not even their annual physical, or if they go, it's 5 minutes. Hey, you're great, leave. There's no value in that. But once you have a doctor who actually is telling you, hey, this is what healthy is. Here's your blood work. Here's your vitamin levels. Here's your mineral levels. What are some of the small things, symptoms that maybe you're having? There's a reason you're tired all the time. It's because you're vitamin D deficient, right? Things like that. Now you're actually seeing value, which means the employee is engaging primary care. Now it all makes sense. So then my goal was to find out how many DPCs were and try to work with them. And that's when I reached out to Direct Med, and the rest is history.
Makes sense. Are you guys familiar with value-based care model?
A little bit.
Okay. It's become real popular in the Medicare space, right? Which again, now we're looking at the individual market, but their argument is similar. It's like, hey, look, if the entire medical industry competes on volume, then price goes up, care quality goes up, et cetera. But if instead we can teach doctors to compete on value, well, then value must go up, must increase, right? And I'm kind of hearing a lot of the same thing with you guys. Now, everything y'all are doing is in the group space, right? We're talking about this in the group space. I'm going to ask you about individuals in a minute, but looking at it again from the group side, are there any group industries, types of companies that this just doesn't work for?
Not that we run into. Anything from blue collar to white collar, trades, IT, other medical practices. I mean, every industry is experiencing an increase in their insurance. And depending on the industry, some illnesses or symptoms may be more prevalent than others. But again, if you have a doctor who's helping you be proactive, then they can address anything that's going on, because as Neer mentioned, DPCs can do 90% of the care that you need. So it doesn't matter what industry you need or you have, DPCs can handle 90% of it.
Absolutely.
We also get asked a lot from employers. Well, I got offices all over the country. I got remote employees spread out all over the country. So how does this work for a company like mine? And that's the beauty of having no network restrictions, right? Every single provider and facility in the country is considered in network in our health plan. We're going to do the same, calling around, getting the cash price, giving the member a cash card that they can use to pay when they go in every state in the country. So this scales up and down really easily, no matter where people are located and no matter how big or small a company is.
So how many doctors do you guys have in your group or your platform?
Alliance. We like the word alliance.
Yeah.
Alliance. Yeah. How many doctors are you aligned with in your alliance?
So my wife's been a DPC physician for 10 years. We started our practice, Direct Med DPC, in Austin, Texas, 10 years ago. And from that point that I've been involved in the space, I've seen new DPC practices opening every single month for the last 10 years. And they were already opening also before we started ours. So there are several thousand DPC practices around the country right now. There's a map, mapper.dpcfrontier.com, where you can go and look at the map there, and all the green dots are all the independent, genuine DPC practices. And then again, like I mentioned, there's a whole DSC movement that's happening now. So direct specialty care. So if you Google Direct Specialty Care Alliance, you'll find their map. There's probably a few hundred around the country right now of specialists, and there's more and more that are being educated and coming to the conferences and wanting to do this. So that movement's a little bit behind us in the primary care sector, but they're going to be growing exponentially just like we are.
So if I'm in one of your groups somewhere, whoever I work for, and there's like, no, we're signing up with Virtuous Benefits and the direct primary care model, and I want to go find me a doctor, you're telling me that it's basically limitless.
So far from what we've seen, we've never had an issue pairing up an employee with a DPC physician where they've been located.
And our goal with that, just to expand on it, is to help you find a DPC physician That's anywhere between 30 to 45 minutes from where you live or work, right? Obviously less if we can find it. Because again, you don't physically have to be there every single time.
Sure.
With your typical traditional doctor, you do, even for a follow-up visit, right? Something that you could have handled over the phone. Again, because this doctor works for you now, if you need to get care remotely, right? They know you, maybe you're on vacation, you had some bad food, you had some food poisoning, they can triage you and help you, right? And if you need a medication, there's a pharmacy near you. Hey, just go pick up at that pharmacy, because again, there's no network restrictions. So even if there's some remote employees out there, we can still help them find the care that they need.
I had mentioned it earlier, or asked, is there any type of employer or type of company that this doesn't work for? Is there any type of employee that this really just doesn't benefit or work out well for?
There's still some employees, a very small percentage, I would say 5 to 10% of a workforce that just says, you know what, this sounds either too good to be true, or I really don't want to be calling you. I just want to do the same thing that I do previously. I don't want to change doctors, and that's their choice, right? So what we do in these health plans is we'll set up a dual health plan. So one that's DPC based, one that is non-DPC based.
Okay.
Still no network. That employee can still go see whatever physician they want to see. If it's been their physician for 20 years, we can still pay them, because again, we're paying providers directly. We're not waiting on them to be in network or out of network. So we're going to help them. But ironically, over time, even that small workforce that kind of denies it at first starts seeing their coworkers and their colleagues realize, hey, your doctor can see you same or next day. Even though I've seen my guy for 20 years, I still got to wait a week or a few days to see them, right? And there's other incentives that are built in, but they still are seeing that over time, it's better to jump on DPC.
Right. So it's just resistance. It's not necessarily a person with certain conditions, right? Certain medical diagnoses for them. The DPC doesn't necessarily not work for them. It's just their own personal resistance through habits and what they become accustomed to, right?
Absolutely.
And just to
People don't
clarify
like
that,
change.
Yeah, just to clarify, we're not changing specialist. We are just asking them to try DPC on the primary care side.
Correct.
So if something has a serious illness ongoing, you can absolutely still see the same specialist. We're just going to recommend a DPC to kind of help coordinate that, give you some discounts where you need it, labs and imaging, but you could absolutely keep the same specialist.
And then going back to what Neer said, your primary care can handle 90% of what you need. So you may not need as many specialist visits anyway.
That's right. And
right.
That's right. And one thing we didn't talk about with that group that we mentioned in Alabama, the other things that we do to incentivize employees to try DPC or try the DPC plan is we say all your DPC care, your membership with your DPC, completely free, costs you nothing. All lab work that your DPC physician wants to order, not just the annual work, all blood work for the whole year, completely free, costs you nothing. All imaging, even advanced imaging, x-rays, CT scans, MRIs, ultrasounds, all imaging that your DPC physician wants to order, completely free, doesn't cost you 1 cent. All generic medications that the DPC physician prescribes, completely free. So we're doing everything we can to almost eliminate the employee's out-of-pocket expenses in our health plans.
When it comes to usage, right?
Mm-hmm. Absolutely.
Absolutely, yeah.
Are the doctors, and this is why I brought this up earlier, the value-based care model, they have incentivized payments for the doctors when they can prove that they improved your health outcome, right? So, because that's, again, the whole idea, right? The doctor can now spend more time with you in the value-based care model, just like they can in the direct primary care model. But if that doctor can prove that, like, hey, I improved their chronic illness or I cured them, whatever it might be, they actually earn more money by being able to validate that they improved your health outcome. Is that similar in the DPC space? Are there incentives or bonuses built in for the doctors? Like, hey, I helped Angel overcome whatever it might be, right? Do I get more money? Is any of that built into the model as well?
Generally not, not as far as like incentives or bonuses. The DPC physicians, they're making a very, very good income when they have a full panel. And a full panel, by the way, for a DPC physician is around 600 patients compared to a insurance-based PCP, a full panel is around 6,000 patients. So it's a fraction of the number of patients, which is why they're able to spend time and deliver such high quality, genuine care. In our health plans, we are able to, help the DPCs increase their membership fee over time as we prove to the company that you have huge amounts of surplus money rolling over every year, and the DPC is doing 90% of the work, right? They're the front lines for every single employee and family member every single time there's a healthcare need. So, we need to pay them $10 or $20 more for their membership fee next year. There's no problem in doing that, and the employers are happy to do that after year one is completed, and they can see the hard results of what we're able to do for them and
Makes
their
sense. Makes sense. Is there a certain group size that a group needs to be able to plug into this model to make it worth their time?
Typically, when we're talking about all the incentives that were mentioned, we want an employer to be at around 10 or 15 employees.
Okay.
Just because that's where we can actually use some of the tools that we're talking about. For smaller groups, we can go down to 2 lives, but we're essentially giving you a high deductible health plan that's HSA compliant with a DPC membership, which is still powerful, because if you think of those groups under 10 or their employers under 10, every single one of those employees is vital to that organization, because if they don't show up, there's no one else to do the work, right? So when you have now a team doctor that's going to help you stay healthy, right? And now you have a high deductible health plan that's going to lower the cost of your insurance. And then now you have money to contribute to your HSA, which is really buying down your own deductible and keeping more of your own money, right? Tax-free. That's still a solution for a small employer. But some of the other things that we've talked about, we can do at a bigger size employer.
Makes sense. That makes sense. I got a couple more quick questions before we wrap this up at the hour, but we've been talking about it obviously from the group side a lot. What about the self-employed guy who just works for himself? Maybe he's a 1099 hustler and he's like, man, this ACA plans are garbage. They're expensive. They have huge deductibles. Some of them, they're network driven. They have all the buzzwords, right, that he doesn't want in his health plan. He wants the freedom of choice and he wants a real price point that he can work with. Is this available to an individual guy?
So DPC is. So we throughout our DPC practice of 10 years, right, we've got all different types of folks with all different types of employment situations. When we run into 1099 workers or self-employed people that don't have W-2 employees that can't form a group plan, we'll generally talk to them about health share plans. Zion Health Share is a good one that we like, that we've had good experiences with. And so, I'll have a conversation with that individual. I'll ask them about their health, their family members' health, right? Is there anything major that's going on that we can't handle in the DPC practice? Again, we can handle about 90% of their care, but do they have cancer that they're worried about recurring? Do they have some, serious illness that puts them in the hospital every couple years, right? If that's going on, then a health share is not a great option. But most people, again, who are working are relatively healthy. And so if we can handle the things that they have, hypertension, diabetes, hypothyroid, right, all the general conditions that people have that can be handled within a direct primary care practice, there's no reason why they can't go to a health share plan, which is, generally 10 times less than a traditional individual insurance plan. And that'll kind of hang around in the background and help them with the bad things if they end up in the hospital or they get cancer. And then the DPC practice will handle about 90% of all the rest of their care. Makes sense.
Where do you guys see this in the future? Like what do you think, say in the next 5-10 years, maybe further, what do you think DPC's role will be in specifically in group benefits, but maybe individual as well?
I mean, we think it's just going to keep expanding and even faster, because every time we go to conferences every year, DPCs have a few conferences every year. Those conferences have just been growing, because the moment a DPC reaches capacity, the first thing that they do is go talk to a colleague that they used to work with, say, hey, I know you're tired of this run around. Guess what I've been able to do? Not only am I financially successful, but I'm able to take better care of the patients and use the training I went to medical school for. So that is growing and growing and growing. Our job at Virtuous Benefits is to continue to educate employers, letting them know that this solution is out there, and that's going to keep expanding as well. So in 5 years, you're going to see Virtuous Benefits explode and more employers using our strategy, because that's just going to be the future.
Who do you think's driving it more? Is it doctors driving it more, right? Is it their desire? Like you talked about all these conferences and so forth. Do you think the movement of DPC is more fueled by the doctors being tired of the volume play and wanting to have a real business with a real practice that makes real impact on real people's lives? Or is it the health insurance people that are burnt out of the old health insurance way of doing things and they know there's a better way? Or is it the employers? Is there one side of that that's really the fuel behind the drive, or is it just a culmination of those three things that have kind of all met up and said, like, wow, we're all tired of this.
From
and
my
we all want
perspective,
something better.
From my perspective, doing DPC for the last 10 years and talking to these doctors every day, it's definitely the doctors. They're just absolutely miserable working, basically being a pawn for Blue Cross and United to, see someone for 5 minutes and then send them up the ladder to specialty care or to expensive medications and, keep the money flowing within the system. They're absolutely tired of that. That's not the reason they go to medical school. Most doctors have a genuine passion for patient care, and they learn all those tools in medical school from mentors. And then they come work in the traditional system, and they're like, this corporation or this private equity person or this administrator is breathing down my neck all day long, reminding me to see more and more and more patients. And the quality just, is terrible when you're forced to do that. And so they're like, I can see all these other hundreds of colleagues of mine are doing this and they're successful. So I'm going to go and try that too.
Makes sense.
I would absolutely agree with that. And just to give you perspective, without the DPCs, we couldn't grow it as much as we are. Because as an advisor, if I were to go to an employer and say, I need you to try this strategy, I got all the data behind it, I'm essentially asking them to fire 3 people in their life: their doctor, their advisor, and their health insurance carrier. That's a very big decision for an employer to make. And by the way, if they're working with a national brokerage agency who's telling them they do not need to do anything, they're going to completely shut the door on me. So the DPCs, when they have patients who are executives, who are CFOs, who are they have employers as patients, when they have that type of care, the employer now is thinking, hey, this is great. How come my current advisor has never recommended this? How come my current insurance company, who I've had for years, has never recommended this? Now that's broken. And so now we come in and educate them on how to complete the solution. And that's how we've been growing.
Understood. Man, this has been really, really good stuff. I appreciate you guys coming on and sharing this with our audience. Like I said, we've got pretty close to 9,000 members in this Facebook group that are all insurance agents, the vast majority of them. Certainly a lot of them are in the property and casualty side, but we've got life agents, we've got health agents, we've got Medicare guys, group guys in here. Is this something that an insurance agent can get involved in? If they're like, hey, man, I like what I'm hearing, I want to get involved. Like I've been selling group insurance or I've been selling individual ACA. I see what you guys are talking about, and I can see the growth opportunity and the disruptive opportunity. What would you say to an agent who's like, how do I get involved? Is there something in it for me that I can get involved in?
So we're not trying to corner the market and just have Virtuous Benefits do this, right? We are trying to work with other advisors. We've set up compensation structures depending on the involvement of that agent, whether they just want to pass us a lead, they want to close a meeting, or they want to create their own care navigation team, right? We're going to help support them whatever route they want to take. The most popular or common one when we work with agents is, hey, they just want a revenue stream, right? That's why most people get within insurance. I want a revenue stream. I want to build a book of business. We can help them do that. So we invite them, call us, let us know what your current situation is, what you're selling, if you're willing to be trained, or if you just want to provide us leads. But we're absolutely willing and wanting to work with other agents.
Perfect. What would be the best way for someone to reach out to you?
So there's various ways they can reach out to us. Our website, www.virtuousbenefits.care. You can call or text us, 512-887-3011. You can live chat with us on our website. Our email address is info@virtuousbenefits.care. We'd love to hear from you.
Excellent. Well, man, thank you guys so much for tuning in. For you guys thank you all for joining us. Thank you guys for tuning in. This has been a great show. A lot of great engagement. We've got that web link in the comments, www.virtuousbenefits.care. And as always, this is going to get pushed out to YouTube, TikTok, LinkedIn, Instagram, all the channels. So if you don't like the long format and you're a watcher, go find the short bits. But man, thank you two guys for tuning in or for joining me today. I really appreciate this. This has been enlightening and definitely different from some of the normal topics that we talk about on the show. So
happy to be on. Thanks for having us.
Thanks for having us,
man.
Tony.
I definitely, and as I've already mentioned in the past, like I definitely owe a further conversation with Neer because I want to get my group here set up on DPC so that I can provide some level of benefits to my small group of guys that I've got in the agency here. So thank you all again. And as always, guys, we do this show on Tuesdays. This is the kind of value we're bringing every Tuesday, 9 a.m. Until next time, we'll see you on the next Tuesday training. Thanks for tuning in.